is Mandi Pierson, and I am a counselor and director at Porchlight here in Columbus. So we do counseling, consultation, and training. So addressing mental health is, as we think about recovery, is super important for a couple of reasons. So if we break it up into thinking about mental health as it evolves, before most people are impacted by substance use, they first have what I would call like a pre-existing condition of either a mental health concern or trauma, and then they start using, which becomes its own situation. And then after that, in early recovery, we see folks who have had their brain chemicals and their body chemicals and everything else sort of confused and impacted, and everything is off. And so things feel either numb or sensitive or overwhelming. And so people have, a third sort of window there where they have a lot of symptoms going on, but they're also in early recovery, so it's hard to tell what needs treated and what will dissipate with a little bit more stability. And so then the last one is after people have had a little bit of recovery time, their mental health may look totally different than it has in any of the other windows. So we really can't think about treating substance use without considering mental health, because it was the first thing that existed, right? The first situation was either trauma and or mental illness, and so we want to make sure that we're not just encouraging people to stay sober, don't use, don't drink, whatever, when really what we're saying is let's get to the bottom of how we got here in the first place. So in my experience, there is always an underlying mental health issue and almost always trauma. In my experience, actually, I would say there is always trauma that precedes substance use disorder. That's not an official statistic, but just what I've seen in my own clients and others that I've worked with. Way to support a person, a loved one or a friend in crisis, either substance use or mental health, is first, and it may seem counterintuitive, but the first is to stop and ground yourself, take a breath, notice how you're feeling, and it may be overwhelmed, and for most of us it's some fear that's going on when we know someone we love is in crisis. So taking that breath, getting grounded, noticing what I am able to do versus saying I'm going to do anything that it takes, when really that's not realistic, it's not healthy, and ultimately probably not helpful to the person. So one example I would give is that I'm a trauma counselor. I don't know much about housing, and so I'm going to need to send someone to an expert who knows about housing versus trying to solve all of that myself. So the same goes when it's someone that we love on a personal level. How do I get them to the people who can be most helpful? So when it comes to identifying our own mental health concerns, things that are going on, first we have to know ourselves well and have our coping skills going on all the time. So talking to our friends, going for walks, exercising, eating well, when we have those routines going on and we start to notice something's off, right? So if today's a great example, it's a gray day here in Columbus and cold, and so maybe this morning I had a little bit of a hard time getting out of bed. The covers were more cozy than the rest of the day's options, so I was like having a hard time getting out of bed. Well, that is fine for a day or a couple of days in the winter or whatever, but if it's going on for a while, just noticing like, man, it's been a pattern for me to not be able to do this very well. And that's just one example. So one thing I tell people is, let's set a date, like 2 weeks from today. If you're still having a hard time getting out of bed every morning, let's call our primary care doctor. Let's get in touch with the counselor or something like that. So noticing when, hey, I've been talking about this one particular problem for a long time and it's not changing. And noticing, okay, I need to call my counselor and just be in touch with someone who is more than friends, who are just gonna be supportive and loving and kind, but someone who can talk to you sort of from an objective place and be able to provide whatever help you might need. Stigma causes the greatest damage to someone trying to recover, because stigma really is what separates us. And so if I'm a person who is in recovery and I relapse, what stigma has done is said, you don't belong here. Like, we're different, we're not the same, you need help and I don't. So it does to the person in recovery who maybe has had a lapse or a relapse. It says, I can't ask for help, I can't ask for what I need. And it also says to the community, I can't ask for what I need when I'm in their shoes down the road. And so there's this great separation that happens, and it keeps both parties from getting what they need. And I think it takes away from our community as well, and saying, when you're in trouble, when you're hurting, we're gonna be there for you, and we have this opportunity to give generously and show up generously and be kind and be welcoming. And so it kind of hurts both sides. And when we notice, hey, I have to have boundaries, but I am able to show up for another person who's hurting or in crisis, both sides kind of get what they need, and that stigma becomes smaller and smaller. Because I haven't met anyone who hasn't needed something at some point, right? And so when we recognize that, we're able to give and receive generously.